Hello everyone, I'm standing by the banks of the Murray River on the traditional land of the Wiradjuri people, and behind me you will see a firthing tree. Now, trees like this will be used by the indigenous people for thousands of years, and indeed this tree probably for hundreds of years. To my left and in front of me there are a series of bulrushes. Again, they would have been used by the traditional people. These bulrushes are known as Wodonga, and the town I'm in is Albury Wodonga. Albury on the New South Wales side of the border, and Wodonga in Victoria. Now, the indigenous people of the region would have connected very strongly with the natural environment. Indeed, their lives were entwined with the natural environment. And here in Australia, there are 6 seasons amongst the indigenous people, not 4. And the season we're in at the moment is the season of butterflies, which is followed by the season of eels. We will be hearing a series of talks on botany and people, and how botany and humanity and civilization are entwined around the world and across time. So I hope that you will enjoy these free talks. Thank you very much. Michael Dooley is a gynaecologist. He has a practice in Harley Street, and he also works at the Poundbury Clinic in Dorset. He led a tour for us to China looking at integrative medicine, how Western and Eastern medical traditions integrate. And I think this is a broad range of knowledge and experience that makes Michael's talks and tours so fascinating.
Well, good evening, everybody. And first of all, can I wish you all a very, very happy Christmas and welcome to this talk. The title of the talk is Imagine Creating Harmony in Health. I'm a consultant gynaecologist and run the Poundbury Clinic, but really believe if we can address harmony in health, we can create a healthy, happier future generation. My talk is trying to link the work that, the fantastic work that's been done at the Chelsea Physic Garden and the talk by Helen Bynum, the 3 friends in winter, to health. But first of all, I'd like to thank John Baines, Emma Tracy from John Baines Tours for putting this on, but also thank the Chelsea Physic Garden for being so supportive of this, and their garden is just a diamond in London, and I just cannot stress how wonderful the whole 4 acres is, and well worth a visit and many visits. We've got to go back. The Chelsea Physic Garden was founded in 1673 for the Apothecaries to go and study there. And I think they studied for 3 to 4 months in order to understand the role of herbs and flowers in health. And now we've got to project the future. And I think we're beginning to go round in a spiral. And the modern doctor is going to beginning to use this, because we're realizing that a lot of what we did in the past is perhaps not necessarily a bad thing, and we need to encourage it and look at it and address it again in the future. And I put Imagine in because I'm a great fan of John Lennon, and I think John Lennon can really connect this. You know, what he said, imagine all the people living life in peace and sharing all the world. You may say I'm a dreamer, but I'm not the only one. And I may be a dreamer, and it may be something that may be overambitious, but if we don't strive for healthy, harmonic healthcare, then it's going to be a sad world. And we've got to prevent a lot of the problems that are going to occur. And we've got to strive for perfection. Henry Royce did when he said, strive for perfection in everything we do. Take the best that exists and make it better. When it does not exist, design it. Accept nothing nearly right or good enough. And surely that's what we must do for healthcare, for our future generations. We're worrying about the environment. Calamity Brown talked about planting trees, that it was for the future, and we've got to be the future and look at helping our future generations. But we also got to look at the past, and life is respecting the past and learning from history. And I think this is just a classic time to do this. Look on the top left-hand part of the screen. This is the penicillin exhibition train that in 1945 went around England showing and talking about the benefits of penicillin and also raising funds for St. Mary's and the research to be done by Sir Alexander Fleming. And the photograph on the left, on the right of the screen, taken by John Jark, who is the grandfather of David Suchet at St. Mary's, this gentleman giving one of the first injections of penicillin to Maureen, who sadly died of bacterial endocarditis. So there, 1945, a train going around to demonstrate the benefits and the need for thinking about penicillin. Move on. What's happened now? The Duke and Duchess of Cambridge, bottom left-hand part of the screen, have now gone around to thank all the key workers for the dedication and hard work they've done during this awful pandemic. And there in the central part of the screen is the world first immunization against the COVID vaccination. All my life's a spiral. Trains in 1945, trains in 2020, two most important injections that the penicillin saved so many lives, millions of lives, and the vaccination now will save millions and millions of lives. And this photo on the right of the gentleman giving the vaccination to Maureen is so close to my heart, because that's my father, and he worked with penicillin, and he taught me about the harmonic approach to healthcare and how we've got to be holistic and look outside the box. But let's move back in history. William Mayo of the Mayo Clinic said, the aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of the physician. The ideal of medicine is to eliminate the need of a physician. And therefore, we've now got to look at creating and encouraging healthy, happy, equal, safe future generations to live in a healthy, happy, safe, sustainable environment. In my mind, yeah, the environment is so, so important. And the work that David Attenborough and everybody else are doing are just unbelievable. But we've also got to look at creating healthy, happy, equal, safe children, future generations to live in a healthy, happy, safe, sustainable environment. One, in my opinion, is not enough. And that's why the teacher of today is the doctor of tomorrow. By talking about prevention of ill health, we can therefore prevent problems not only in the children themselves, but as you'll see in my talk, in future generations, because of the effect it will have on their child and their children's children. But go back, how can we connect this all up? And it's all such a harmonic, fantastic world that we look at geometry. And if you look at geometry, it's so, so fascinating. And Thales and Pythagoras' theorem, looking at different diameters and radius and angles, etc., and the number pi. But that's not only where it happens. It's not happening just with the compass, but it's happening in nature. And if you haven't read it, do read the book, The Hidden Geometry of Flowers. And it is just wonderful, the shapes that flowers create and how there is a hidden geometry in nature. And that surely is what harmony is about, bringing it all together. And you can see with these diagrams, this beautiful sunflower on the bottom right, how interesting and how nature and geometry, and we are part of nature. And look, imagine harmony in health. On the left, a 3-day embryo. What a beautiful structure and how geometry is even playing a role here. So I've taken the word harmony, taken our shapes and our geometry, and just going to think about 6 things. Happiness and health. H, happiness and health. A, an active mind and body. R, reflection. M, membership of society. N, nature and nutrition. And Y is you and your team. And it's all linked together by O, the oneness. So let's talk about it. And I'm just going to spend the next 10 minutes just going through those and how it can make a difference to our life. Simple. I'm not asking complicated things, but something that is simple that can make it such a huge impact on individuals and societies and the world. Happiness. Going back to John Lennon, I just love this. I'll read it out. When I was 5 years old, my mother always told me that happiness was the key to life. When I went to school, they asked me what I wanted to be when I grew up. I wrote down happy. They told me I didn't understand the assignment. I told them they didn't understand life. They didn't understand life. And you can see that in so many other areas of life. I went to a horse stud because I'm interested in animal breeding. I went to the owner and I said, apart from good nutrition, what's the most important thing for your mares to get pregnant? Instantly, without hesitation, she said, they've got to be happy. They've got to be happy. And if you haven't already, do look at the Action for Happiness, most wonderful organization, fantastic app. And they have this great dream of giving, doing things for others, relating, connecting with people, exercising, taking great care of your body, appreciating and noticing the world around you, trying out and keep on learning new things, direction, having goals to look forward to, resilience, find ways to bounce back, emotion, take a positive approach, acceptance, be comfortable with who you are, and meaning, be part of something bigger, a great dream, which in some way is very similar to my harmonic approach. Then we go on to active mind and body. And there's no doubt that if you don't use it, you lose it. And we've got to encourage that from early childhood to late adulthood, to keep on using it, to make it active. And the same with our muscles. So we've got to use the mind, we've got to use the body, we've got to improve our muscle tone, we've got to be aerobic and exercise, and we've got to look at cardiovascular, etc. And it doesn't have to be complicated. And I think that's, again, the important thing. And it's so sad. And we look at the environment, the architecture now. What's the first thing? What's the first thing you see when you go into a building? A lift. I don't think there's a lift actually at Chelsea Physic Garden. I must look for it, but I can't find it, which is wonderful. In the old buildings, what was the first thing you saw? Was the stairs. Stairs are hidden. And we went to a conference recently up in Glasgow, an exercise conference. We couldn't find the stairs. We couldn't find the stairs in this hotel. We actually complained to the organisers that we couldn't find the stairs for people to move up and down. You always have to go by lift. Isn't that an appalling part of architecture? Yes, the lifts are for the sick and the infirm, but let's lose the stairs if we can. Now we move on, time to reflect. And it is now obviously the time to do that, when we've all changed our lives in such a dramatic way with the pandemic. And what I propose to you or put to you is, in the rush to return to normal, consider which parts are rushing back to. But sadly, we do forget, but try not to forget and think about the positive parts of there are some awful, awful things that have happened to individuals and some dreadful situations of poverty and loss of jobs, etc. But there are some other important things that we can learn from. But we must not forget how it is created inequality. We must create equality, and we mustn't allow inequality, the problems of social inequality, now digital inequality, is appalling, with 20% of children not having access to the internet or a computer and then have to homeschool. We are going to see huge changes, and we must work on that, but also reflect on what sometimes is good. And Gandhi said, have a day of silence. I'm not sure we can have that, but you've got to have silence to help, I call it marinate, to percolate the mind. And that's the importance of sleep and the benefits of sleep. In my longer talk, I would talk about the benefits of sleep. And I encourage my patients to have 1 minute silence, 1 minute silence 3 times a day, and go for a walk in silence. Hard to do, easy, hard to do. And do buy this book, Do Pause. You Are Not a To-Do List by Robert Poynton, who it's fantastic and it's so insightful and well worth a read. Then we look at membership of society, and we are not an island. We need society, we need that interaction. And that's why I don't like social isolation or social distancing. We mustn't have social distancing, we must have physical distancing. The social distancing, I just went for a walk and I met a friend on the common, and we physically distance, but we were able to socialize and talk about our school days. So Bernard Shaw said, I'm of the opinion that my life belongs to the whole community, and as long as I live, it is my privilege to do for it whatever I can. We are not individuals. Being part of community is good for you, is good for the community, is good for the future generations. And I think that has been definitely seen by this recent pandemic. And being together, creating a society, be part of a belonging, and help prevent all the awful social inequalities that had occurred. And that's why, if you think about it, what happens in prison as punishment is isolation. Anything that happens in prisons as a punishment can have a negative effect. Isolation, poor nutrition, possibly lack of exercise, sleep deprivation, all these things have a negative effect. And loneliness is associated with an increased risk of mental disorders, depression, anxiety, low self-esteem, and poor sleep. And poor sleep has a huge effect, not only on your mental, but also your physical health. Moving on, you and your team. And we are not an island. And people always say, no, it's all about, no, it's not about you. And you can't do things alone. We need teams. And as Eddie Jones said, team is like a tea bag. You don't know how good it is until you put it into hot water. And we've seen some great teams during this pandemic. But that's why you've got to create teams around you. And you know, that's where Weight Watchers is so important. Why gyms with personal trainers are so important. You have that team approach. It's not an individual. It's much harder to do things without the support of outside people. So it's you and your team. Tiger Woods he knows how to play golf, but he still has a team around him to support him. Andy Murray knows how to play tennis, but he has a team around him. And I think Lewis Hamilton, in his team, I think 1,500 individuals. So it's not alone. You create a team to help you. And then finally, linking this all up, nature and nutrition. And I always say the most important environment that we all have been in is the environment of our mother's womb. And what can go on there can have a huge effect on our health. It can upset obesity, it can be associated with heart disease, it can be associated with long-term risk of cancer and other mental disorders. And here, a marvelous study by Robert Lee, who's shown that the sperm is like maybe the canary of the future, that the canary in the mines saw toxins in the mines, stopped singing or died. The sperm count is going down, and there's evidence now that the effect of environmental pollution may be decreasing the sperm count. We're still able to reproduce, but how long can this go on? And there is evidence this is happening also to women's eggs reserve. So environmental pollution is affecting the child in the mother's womb, which is then affecting the fertility of that child for future generations. And don't forget the egg in the mother's womb. The woman in the mother's womb gets her eggs that makes the next generation. So it's an ongoing, we are not an island. We all affect our present health, our future health, and our generations of health. And the environment of the womb makes the womb a promising target for prevention, raising hopes of conquering public health scourges like obesity, heart disease, through interventions before birth. And this is where the teachers have such an important role in order to educate the children, the present children, who are the parents of the future, who are there for the parents of the future generations. And what goes on in the womb sows the seeds of ailments that afflict adults. And that's why we've got to also look at nature. And talking about fertility, I just thought I'd just share with you that plants grow in cycles. So we have geometry, the beautiful picture of the 2-3 day embryo, which has a geometry to it. But plants grow in cycles, but so does our body. And here we have a fern on the top left-hand side, but on the right-hand side is cervical mucus, the mucus of a woman who is gradually, A is not, B is not so, but C and the lower ones show fertility, cervical mucus. This is when the woman is in the mid-cycle, so the cycle of the hormones affects the cycle of the cervical mucus, and this therefore ferns when you dry the cervical mucus on a slide to allow fertility to occur. So the body goes through cycles, as do the plants. Wonderful. Then we look at biophilia, the connecting nature to health. So simple, this. But hospital inpatients with a window and a view of nature have shorter stays than without such a view. They use less pain medication, and there's general improvement. Use of natural light, large windows, natural colour, not complicated, not expensive. But just think just even reducing pain medication, how the effect of that, purely look financial, the money saving, but also pain medication can cause constipation, can cause gastric upset, and the iatrogenic causes of disease is so enormous. So if we can cut that back by simply going back to nature and using the natural light, the natural the colours, etc., so important. And it's not, again, I'm not talking modern stuff, that Robert Powell said in 1839, nearly 200 years ago, the healing power of nature. We've got to go back to the past and learn from the past and bring it on to the future. All my life's a spiral. And he argued that many illnesses could be cured without the aid of medicine, but by paying attention to air quality, the food we eat, how much physical activity we did. We're not saying things new. I'm not the Doctor Who. I'm just saying how simple things can do, and we create and imagine a harmonic healthcare system. And this leads you on, which we are trying to do with social prescribing, which is going on with GPs, and it's community referral, and it's GPs, nurses, and primary care doctors and other health professionals who are referring people onto a range of non-clinical activities. And that it is working with the environment, and social prescribing addresses the needs in an holistic way. The use of referral to gardening clubs or bridge clubs or walk and talking clubs, etc. We need now, however, in my opinion, to connect this to secondary care, but that's my next mission. And we do know that there may be sort of inoculation, that encouraging people to go for walks in countryside, go for walks in nice, clean environment, may be like inoculation. We inoculate against the COVID virus to help people, prevent people from getting it. If we can behaviorally inoculate, we may decrease depression, weight gain, etc. So let me go back that we need to create and encourage healthy, happy, equal, safe future generations to live in a healthy, happy, safe, sustainable environment. One of these is not enough. That's my dream. I may be a dreamer, but I hope I can encourage you to come along with me, that I'm not the only one. And thank you again. Very happy Christmas. And any questions we can talk later on about. And thank you for listening to me.